Hi, this is Junaid, neurocritical care stroke and epilepsy specialist. We're going to continue with our module financial considerations, and today we're going to talk about wage gap between executive and clinicians, and unfortunately it is growing. Now, why am I even bringing up this topic? The reason that I'm bringing up this topic is that at least in US, healthcare is a business. It is not a charity. It is not a government-funded entity. It is actually a business. And when you are talking about businesses, you have to take that into account. And I want to open up your eyes to whatever the idea behind a business and how it works. Now, all fairness, every other industry, there's a huge gap between CEO pays and worker pays. So it's not per se different. Medicine we see feels a little different because as a physician you are actually talking about being at the top of your line. You're actually a clinical leader per se, so it feels a little different, but at the end of the day you are a worker, you are an employee about 70% of the time. So there is definitely that sort of situation going on. My purpose over here is for you to understand that is the real truth, real reality of business of medicine here in the United States. So you have to take that into account. Some of this data is old, but unfortunately we don't get as good data about these things as we should. So as you can see, from 2005 to 2015, CEO compensation rose by 93%. That's a huge difference in terms of 10-year as far as compensation increase is concerned. Unfortunately, within that 10-year period, there was only 8% increase in worker pay, which, to be honest with you, includes all of us, nurses, respiratory therapists, physicians, advanced practice providers, everyone. So the point itself is that the compensation gap is growing. It's actually significant, as you can see by the numbers. Now, cost of wages has actually, to be honest with you, quite frankly, stagnant if you look at physicians and surgeons. I mean, there's a clear slightly going up, but that's if you account for the national inflation that's going on, it's really not that huge. But non-physician clinical workers, it's increasing more than, and total healthcare industry, the wages cost has gone up. So non-clinical workers are definitely with getting in to the business of it and are costly, and some of them are very important. Like there's a huge push about cybersecurity, digitalization of health. So those are software services that we do need for healthcare industry in general. So that is also adding to the cost as well. But at the end of the day, if you look at the physicians and surgeons participation of the cost of wages, it hasn't really changed that much. Growth in numbers, the number of people that are getting into the industry as physicians and surgeons is barely changed. I mean, if you look at the overall number in terms of if you look at the number of millions, etc. So the rate of physicians and surgeons getting into the market has not changed, but non-physician clinical workers, of course, nurses have increased, advanced practice providers have increased, non-clinical workers, has hospital administrations, healthcare administrations, software IT, etc. people have significantly increased. So the number of people within the industry is going up. However, the physicians and surgeon workforce has remained stagnant. Cost versus expenditures. So it's interesting, the national cost of healthcare wages has gone up, and that should, because if you're looking at a 10-year period, if you could do 2% inflation, you actually end up around 20% plus, because that's a compounded growth. So you're looking at 24% growth. That's just inflation. So there's clearly a growth that is going on. But unfortunately, the national health expenditure, the amount of money that we spend overall on healthcare has skyrocketed, but the wages haven't really gone up. And that's an important consideration. Again, it's a business of medicine. You have to make sure that these things are going on. I really don't have a comparison. And if you do, just put it in the comments. But at the end of the day, I don't really have a comparison for other industries. But clearly, with this great resignation of 2021 and everything, we're seeing that the workers in other industries are revolting. But I don't know, for example, healthcare, we're seeing a lot of nurses that are going into travel nurses because clearly they are not able to accommodate for this huge shift in inflation while everyone else is getting paid. So there are some areas and pockets where we are seeing this, but at the end of the day, there's a huge mismatch between the expenditure, national expenditure, versus the cost of wages. And this is unfortunately ever growing. As you can see with the chart, it's not just stagnant that, okay, 1 year it was bad. It's literally, you can see that the gap is also increasing as we move forward. Now, pandemic, you would think that, this would be a bad thing and the CEO pays would have gone down. It's interesting that the 178 CEOs of different hospital systems collectively made $3.2 billion within the coronavirus, which was 31% more than 2019. So I'm okay with making money. I mean, don't get me wrong. I mean, that they're sometimes great people who to work with. I talked to a few of them. But at the end of the day, it's the gap, again, is increasing while 30% more. Let me explain that. If they were making $1 million, they're making a $1.3 million in 2020, 2021 as compared to 2019. It is what it is. Just wanted to make sure that you understand the business of medicine side as well, because that's where sometimes, the disparities do shine. But again, the whole idea is just for you to understand different data points and for you to understand sort of the nitty-gritty of things that I see as part and parcel of practicing medicine here, at least here in the United States. Now, from 1978, the CEO pays have skyrocketed. It's 13,000. Again, this is not, I'm going to reiterate it, that this is not just the healthcare industry. It is every industry, by the way. The healthcare industry actually comes in the middle of the block. I wasn't able to find hardcore data behind that, but at the end of the day, this divide is widening everywhere. And we're going to come into consolidations and all that, why this widening is happening as well. There's some good reason behind, increased pay as well, don't get me wrong. But at the end of the day, when you look at the overall data, physician pay has sort of been stagnant or slightly increased, but clearly there's a huge difference when you're looking at the CEO pays, which is the top of the line. Again, when the CEO gets paid, the board gets paid more, and then the vice president get more, etc. Then etc. The C-level executives all get higher paid. I get it. This is not a fair comparison from one person to the rest of the place. But as one person's base goes up, the rest of the C-level executives are not going to sit quietly and say, okay, you get the pay, and the board is going to approve it right away. There are consequences. They have to distribute a little bit more. So that's how the overall industry is sort of satiated as far as money distribution is concerned. But clearly there's a difference in the CEO pay and the workers' pay. Again, all this data is on the Academy Neurology website. Make sure you check it periodically, and you make sure that you follow us along on different social media platforms. Thank you. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.